Let's listen in live.
Extends throughout the state of California and beyond. We have had the deep collaborative spirit advance now in states large and small all across the United States, but none stronger than the relationships we have formed in Washington State and the state of Oregon. We just sent out a joint statement of a shared vision for a process and protocol, a framework, we refer to it, for reopening, not just within our states, but more broadly as a region. I don't want to overstate this vision. I don't want to overstate this framework, and I don't want to understate the imperative of meeting this moment by continuing to practice appropriate social distancing and practicing physical distancing so we can continue to bend the curve. But we are at a point of time where, not dissimilar to the announcement that was made an hour or so ago on the East Coast, that we're beginning to socialize conversations we've been having over the course of many days, in the case of the Oregon and Washington governor, into the beginning of last week, where we began a process of establishing more formally what it would look like and how we could begin the process of the kind of incremental release of the stay-at-home orders that advance the fundamental principle of keeping people healthy, keeping people safe, using science to guide our decision-making and not political pressure, and continuing to do what we can to share our best practices and share our resolve and ultimately advance the kind of results that everybody is expecting. We look forward to collaborating further with other governors along the western states, but we look forward, in addition to that, to continuing the collaborative spirit that extends well beyond just the west coast of the United States, forming perspectives and opinions, sharing best practices, and ultimately advancing the cause that unite all of us, and that is the cause of reopening our economy and doing so in a safe and strategic and responsible way. And to that end, I want to be very specific. Tomorrow, we will lay out our California-based thinking on that effort. For weeks now, I've been previewing that the state of California is putting together a bottom-up plan, a framework for targeted interventions and easing of restrictions in the state to allow us to toggle between approaching issues on the population basis versus on an individual basis. We're going to lay that out, as I say, as detailed a plan as we can at this stage tomorrow at the noon press conference. But I just want to acknowledge and thank the governors of Washington, the governors of Oregon, Governor Brown and Governor Inslee for their just ongoing partnership, their incredible support and the collaborative spirit that, by the way, goes well beyond just this moment. I want to just extend that spirit was on display at scale last year with the forest fires that we had, particularly in Northern California, where they brought down mutual aid engines from Oregon and into Washington State, allowed us to concentrate our resources in some of the hot spots in Southern California to address last year's wildfire season. So again, it's the spirit of collaboration, spirit of partnership, a recognition that this pandemic, the virus, knows no boundaries, knows no borders. You can't build walls around it, and you can't deny basic fundamental facts. And again, before I transition, we will be driven by facts, we'll be driven by evidence, we'll be driven by science, we'll be driven by our public health advisors, and we'll be driven by the collaborative spirit that defines the best of us at this incredibly important moment. What also defines, I think, the best of us at this incredibly important moment is to recognize that disparities persist, that disparities need to be addressed in real time, that are highlighted and that are exacerbated in moments like this. One of those areas is the well-being of our children. So much has been discussed about physical health issues and mental health issues. We were very pleased by the outstanding leadership and partnerships that we were able to form last week, where we socialized the details through our Surgeon General of resources that are made available to address the stresses and the travails many of us are feeling, and providing resource guides in a very culturally competent way on the basis of age and geography throughout the state of California. But the persistent issue of our children, particularly children in our welfare system, particularly children that are, quote unquote, at risk, remains a vexing challenge, particularly at a time when we have stay-at-home orders, which reduce and significantly limit the number of in-person visits as it relates to our Child Protective Services, what they're providing in terms of casework in real time, in person, that is so important to address vulnerable communities. When the schools are closed, that's another point of contact where people are able to make referrals based upon the interaction of children, the interaction to school nurses, to one another, interactions with our caregivers, not least of which, obviously, our teachers. Those referrals are down. Those in-home visits are down as a consequence of the virus. But what is not down is our guard and our commitment and resolve to work around that and work through that. And so today, we're announcing a $42 million effort, substantially supported by the state of California, $40.6 million of the $42 million direct statewide support coming from the leadership, the Assembly, and the Senate that have afforded us these resources to invest in building supports all throughout the state of California. And what I mean by building supports is along the following. We're tracking about 86,500 children within our system, about 59,000 specific to the foster care system. We want to extend supports small and large along these lines. Resource referrals, more amplification of our 211 system, more connection with the 211 call center to family resource centers, more support for our frontline employees, county-based employees, our partnership with our labor leaders at SCIU, perfect example of the incredible work that's done on a daily basis, Health and Human Service, all throughout the state of California to provide them more resources, more support, and more capacity to continue to do what we can. We're not just knocking on every door, to knock on those doors of those that are most vulnerable, and to continue the kind of telehealth engagement and virtual outreach, as well as phone calls to those caseloads, and to make sure that they have the support to meet the magnitude and the scale of our challenges. One of the magnitude and scale concerns we have is the number of our foster kids that are emancipated on a monthly basis. Roughly 200 young children are emancipated every month in the state of California. At this moment, we think we should extend the emancipation process, and we're providing resources, millions of dollars, to do just that, to extend the time where people can stay with their current caregivers and get the kind of support and food that they deserve. That's number one. Number two, we are providing additional $200 a month for families that are most at risk. Thousands and thousands of families will get the benefit of that contribution to help with food and to help with other incidentals at a time, again, of deep, deep need. We're blessed in the state of California to have an incredible director of our Department of Social Services, Kim Johnson. She's been helping put together this plan, working with our county partners over the course of the last number of weeks. Just reminding everybody, we're not giving up on our focus and our oversight and our legal responsibility to protect our children at this very difficult period of time. And I will ask Director Johnson to come up and fill in the blanks on other specific things we're doing, but I just want to extend a deep appreciation and compliment her outstanding work in putting together this package that goes out immediately, effective today.
Thank you, Governor. And it absolutely is an investment on a continuum to support both families at risk in our system, as well as those who are currently serving as resource families for our foster youth across our state. As the governor mentioned, we have $6.8 million to support additional social worker outreach across communities. This is ensuring that that touch point is occurring, that over time, that we recognize we are asking from you to ensure the health and safety of well-being of children across the state is occurring. In addition, there's a $3 million investment to family resource centers who are not only helping with those connections to resources for at-risk families, but also providing direct material goods in communities and making those connections to counties and other community resources. We are also expanding our helplines. So this is the 211 system that you've heard us talk about before, providing some additional resources to keep our resources the most up to date for families across our state. We'll also be providing resources through Parents Anonymous, who is providing hotlines and connections and support groups for all of the families across the state in need. There is a $313,000 investment in providing laptops and cell phones. So as we have been talking about in our Department of Education and Superintendent have been leading on new ways with distance learning, we want to ensure all of the foster youth across our state have that cell phone access, but also that laptop that helps them and connects them to the resources and education that they need to be successful. We are also, as the governor mentioned, a $27.8 million investment to support that $200 per month need at-risk families. These are our families that are in emergency response and family reunification. Well over 25,000 families will be served in this capacity and support. And finally, I'll mention that we are also providing the $1.7 million to provide additional rates to those caring for foster youth. We recognize that some of our youth have additional complex needs, and certainly those needs have intensified in the course of COVID. So those resources will be flowing as well. The Department of Social Services continues to be a partner across the state with you in this effort. We have issued a number of guidelines. The monthly visitation component that the governor spoke to is critical. The only time a caseworker may conduct visits remotely is if the social worker has determined, based on that individual assessment, that is appropriate to do so in an individual specific circumstance for a child. So we really do recognize that that means getting out that PPE and getting out those resources to you in the field. We are working on that in real time and providing those resources to ensure everyone across the state can do their job. We look forward to continuing partnering with you across this effort.
Thank you, Director Johnson, and again, compliment to your outstanding team and the good work they're doing. I also want to extend a point of personal privilege. Former pro tem in the state of California, John Burton, his foster care advocacy organization has already procured 2,565 laptops as well in the spirit of this kind of partnership and collaboration, working with DSS and others to provide those most at need, particularly in the foster care system, the supports so they could continue to practice their distance learning, continue to extend their educational opportunities, and continue to stay connected despite the fact that we continue to extend the stay-at-home order and the need to practice physical distancing. So to everybody that has really stepped in and helped support this collective cause, public, private, the county level, the state level, I want to just thank you. And for me, this also is a point of personal privilege. We were a foster family growing up myself. Some of the most intense and extraordinary moments of my life were defined by the experiences that were brought into our household by a foster brother, particularly Stephen Ashby, who really enlivened our family and really, I think, brought home the power and the potency of people that are helping support our foster children and letting our foster kids know they're not alone, that you matter and we care, and as a community, we have a responsibility to do more and do better on your behalf. And so know this announcement is not just an intellectual one. We're not just throwing this out there and then moving on to the next announcement. Know that we are committed to doing more and doing better, and we're here for the long haul to continue to reform our foster care system and to reform our child welfare efforts that even before this pandemic needed to substantially improve, and of course beyond this pandemic will substantially need to be improved even more still. In that light, let me do what we do every Monday rather, Tuesday, Wednesday, Thursday, Friday at noon, and that is update you on all the numbers, the trend lines before they become headlines, give you a sense of areas of optimism, areas of concern. The two numbers that I, again, wake up every morning focused on is the number of people that are hospitalized, the number of people in our ICUs. The number of hospitalizations last night was 3,015. The number of people on ICUs was 1,178. Both showed just a modest increase, ICU increase of 2.9%. Remember, a few days back, Thursday, Friday, we actually had a decline in the number of ICUs. Then we saw a number that was flat, modest increase this weekend, and modest again on Monday. So again, these are just proof points that things seem to be stabilizing from a hospitalization and an ICU perspective, but the total number of cases continues to grow, 22,348. That's our official count, the number of people that have been tested positive. So again, growing, but in a moderate way. The curve is being bent because of you and because of your willingness to continue to stay at home, including this weekend, Easter weekend, where we did not see the kind of surge that some people are predicted in our beaches and our parks and playgrounds. We saw certainly increased activity, but it just, again, reinforces why we are so grateful to each and every one of you that are responsible for those numbers not being larger. You're responsible for those numbers not growing exponentially. And I want to continue to remind you of the importance of maintaining this work, continuing to advance the resolve that is required as we, again, all of us have a little cabin fever and look forward to coming back into some sense of normalcy. 687, sadly, 687 families will not be going back to normalcy. Those are loved ones, not statistics, not a stat, not 687 numerically, but families, lives, stories, journeys that people have been on together that have been radically changed because of this virus. Those are the numbers that have lost their lives so far to this virus. And again, our heart goes out to each and every one of those family members, and we certainly hope those numbers do not continue to climb, but nonetheless, those numbers continue to grow. And it's just a reminder, despite the optimism around our being able to advance broad strokes frameworks on collaborative efforts with other states and our broad stroke commitment to advance specific strategies, or at least lay out specific strategies and frameworks tomorrow about state of California and some strategies to get back to work into some semblance of normalcy. We continue to have to track the reality of today, and that is we've got to tame this virus. We've got to continue to practice physical distancing, social distancing, and safe practices that have helped us bend this curve and mitigate what some had thought would be a surge that was exponentially worse than so far it has been.